So Judith, is it okay that I show the MRI of your brain?
Yes.
Good. Well, here's your brain here. Here's your two eyeballs. And this is the bottom part of your brain called the temporal lobe. The thing I want the audience to see is these little indentations are good. That's like a cauliflower, the little differences in the florets. And you can see the darkness in your brain is pretty much the same on both sides. No evidence of any small vessel ischemic changes. And same down here, a little lower in the cerebellum. Cerebellum, which is like a motor control, looks pretty normal. It is normal, matter of fact. Both sides look the same. These little striations, no little white matters. But if we go up higher, we now start seeing this stuff in here. This stuff, these white matter changes in here. This is a ventricle, which is normal. But then the white matter has this kind of cotton, kind of flurry kind of area to it, all around here. And that's the chronic small vessel ischemic changes that come from people that have prediabetes or high blood pressure. And we look around a little bit more. Here's pretty much the same image, this white stuff in here, this flocculent or kind of cottony swips of stuff, shows changes. These little dots in here, this is ischemic changes. This white part over here and here shouldn't be here. And we look in a variety of other areas. Doesn't look so bad when we go down. When we go up, here's a good area. This in here is the ventricle. We can see all this flocculent kind of swips of white matter all around on this left side, and on the right side there's even more extensive. So what we're trying to do now is control the blood pressure and control the prediabetes, get it down to where it's not prediabetic on the metformin, 250 twice a day, very small dose, and we've achieved that. So no more strokes for you. That's at least what we're hoping. Thanks again, Judith. The audience appreciates it. You okay with that?
You're welcome. Yes.
Living independently. Once in a while your knee bothers you, but that's not related to the stroke.
Not part of this story.
Right. And I saw in the ED notes, or emergency department notes, that you came in with very high blood pressure.
Yes, it was high, yeah.
And the notes that we have said it was like 220 over 89, very high blood pressure.
Very high.
And did you know you had high blood pressure, or did your GP just tell you your blood pressure was okay?
No, I've been on blood pressure medication prior to that.
Yeah.
But it was just sort of, I can't remember exactly what it was, but it was 3 tablets.
Yeah.
And it had been the same for quite a while.
Yeah. Well, the requirements and the suggestions that people have now for blood pressure management control are much tighter, much lower than they used to be. So that might be one of the issues. And when we looked before at the MRI of your brain in the report, do you remember what they said about the white matter changes in the brain? That's the part of the brain that controls, like, carries electrical signals. It's like
yes,
the electric
so more.
Said it was more what?
White matter.
More white matter changes than expected for ages.
Yes.
That's true. Now, and one of the things, so the two main things that we're doing with you, now we're trying to get your blood pressure under control, and what was the other thing that we're trying to do?
It was the diabetes.
Diabetes,
yes.
Right.
I was pre-diabetic when I came in.
And we looked through the old notes, and you were pre-diabetic since 2018. And now it's 2021. When we look through the labs, are you pre-diabetic anymore?
No, I am not.
Good. And the other issue that I think might have clouded your physicians in the past is you have, or at least you felt you have white coat syndrome, where you get nervous around physicians so your blood pressure looks higher than it really is.
Yes.
You're worried about that. But the reality is that the MRI of your brain showed a lot of small vessel, what we call ischemic changes, with too little blood going to your brain. That was quite extensive. So are you happy with your outcome overall?
Very, very. I think one of the things is that when I came to you initially, you said that you used an aggressive approach, and there was maybe a level of controversy about it, or it wasn't widely used in the hospital, but you gave me the choice to actually be involved in your management, and I chose to do it, obviously. and I'm very happy with what I did.
Yeah, well, me too. And thank you a lot for doing this video.
Thank you.
Thank you.